today, Abby, Jeff, and myself will be discussing our case, which is Betty. Betty is a 78-year-old female who lives with her 80-year-old husband in their two-story home. Bedroom is on the second level. There's a half bathroom located on the first level. Betty is right-handed and was recently diagnosed with a right one-part proximal humeral fracture resulting from a fall. Prior medical history includes type 2 diabetes, diabetic retinopathy causing low vision, and bilateral knee osteoarthritis. Betty currently ambulates with a single-point cane that she loves. Betty's husband believes that she is slightly impulsive and has poor safety awareness, which may be attributed to her low vision. Occupational history. Prior to her fall, Betty was responsible for and independent in all ADL tasks. However, since her fall, she has been dependent on her husband with upper extremity dressing, including donning, doffing shirts, and her sling. She has had difficulty completing her grooming and hygiene routine and has needed assistance from her husband with reaching items, brushing hair, and putting items back due to her decreased range of motion and her vision. She appreciates her husband's help, but would prefer to be independent as possible. She performs all of the cooking responsibilities and most indoor home maintenance tasks, including laundry and house cleaning. However, the housekeeping has not been kept up for over the past 6 weeks due to her injury. Betty is a retired second grade teacher and is still an active community member, participating in a local garden club and volunteering as a reader at the local elementary school. Betty has 5 children, 10 grandchildren, and 7 great-grandchildren who live nearby and visit throughout the year. She enjoys spending time with her family and watching her great-grandchildren play sports and perform in plays.
Betty's stated goals are as follows. So she wants to be able to put her own shirt on again. She wants to be able to complete her housework and cook large meals without pain. She also wants to be able to complete grooming and hygiene routine without her husband's help. The reason for OT referral: Betty has been referred to outpatient OT services to address ADL and IADL limitations caused by her right one-part proximal humeral fracture. Betty's fracture occurred 6 weeks ago. Her right upper extremity has been immobilized with a sling to this point, but she just received clearance that she can begin active range of motion, active assisted range of motion, and passive range of motion. Some safety precautions and restrictions. Per her physician, we are to perform stretching gradually and slowly. Do not push past her endpoint range of motion and avoid pain. If Betty begins to develop pain, drop back to the previous phase of rehab until pain-free, and Betty should not yet begin strengthening exercises.
So the results from her evaluations and assessments, the patient's range of motion and manual muscle testing revealed that her left upper extremity range of motion is within functional limits, and she has a 5 out of 5 strength for all tested motions at the shoulder, the elbow, the forearm, the wrist, and the hand. Her right upper extremity range of motion includes at the shoulder, her active flexion is 75 degrees. Active extension is 10 degrees. Active abduction is 56 degrees. Active external rotation is 25 degrees. And active internal rotation is 15 degrees. At the elbow, her active extension and flexion is 4 degrees to 112 degrees. At the forearm, her wrist, and her hand, she's within all functional limits, and her grip strength is 5 out of 5. She received a score of 30 on the quick dash with reported significant limitations in opening a tight or new jar, completing heavy household chores, and using a knife to cut food. She reports her right upper extremity shoulder pain as 6 out of 10 at rest and 8 out of 10 during activity. She requires MOD A to complete upper extremity dressing tasks and grooming and hygiene. She's MIN A to complete toileting and toilet hygiene with assistance in bringing objects to head level. She requires MIN assist in completing showering and bathing with assistance in hair washing and maintaining balance. She requires MIN A to complete feeding tasks for assistance in utilizing right upper extremity to bring food to mouth. Patient reports a fear of falling and losing her balance due to her previous fall. After completing this fall's efficacy scale, the client scored a 79, indicating she has a fear of falling. After performing the Berg balance test, the client scored a 31, indicating she's able to walk with DME, her single point cane. The patient's ability to complete ADLs and IADLs has been impacted by her limited range of motion and strength, pain, and fear of falling. The patient displays protective posturing, indicating her fear of re-injury to her right shoulder. She will benefit from OT services to address range of motion and strength deficits, pain, fear of falling, and prevention of further injury.
Just to note, the strength for her right upper extremity was not tested due to restrictions and precautions.
Okay, so her OT goals in the short term, she will increase right upper extremity active range of motion by 30% in 3 weeks to improve independence in grooming and hygiene routine. She will learn and teach back proper upper extremity dressing technique while following her right upper extremity shoulder restrictions to therapist by 1 week. She will gain 25% shoulder active range of motion in all motions to improve ability to engage in home maintenance tasks by 2 weeks. Her long-term goals, she will be able to participate in grooming and hygiene routine with modified independence in 4 weeks. She will be independent in completing upper extremity dressing tasks while following right shoulder restrictions by 3 weeks, and all right upper extremity active range of motion measures will be within functional limits to complete home maintenance tasks by 6 weeks. So her discharge and referrals, therapists are recommending Betty be discharged home without outpatient services when goals are met. Further referrals will be made for home health OT for a home assessment and modifications to address symptoms of low vision and bilateral knee osteoarthritis to avoid fall risks within her home, outpatient PT to address symptoms of bilateral knee OA to prevent risk of experiencing a fall during locomotion and transfers, and an ophthalmologist for further vision evaluation and treatment. And next you'll see our 3 interventions.
Alrighty, so the first intervention is going to be home maintenance tasks to increase range of motion for Betty. As you can see here, I'm putting on the gait belt for safety because of her previous history of having a fall. So Betty utilizes a cane as well, so she's going to keep that in her left hand. And then we're going to ask Betty to come over to a table here. And so the first intervention, Betty will engage in window and counter cleaning to increase her right upper extremity shoulder range of motion. Prior to the intervention, the therapist is going to want to decide on the number of windows and counter spaces that would be appropriate for Betty to wash. So some things to consider is the height of any of the counter spaces, and later in treatment they may be able to progress to washing those windows up high or down low. But today we're going to do a counter about waist high for Betty. So we're going to ask Betty to go ahead and put her hand on the washcloth here. And Betty's going to want to be conscious of, where her weight is at her feet while she's doing this task, because it is a dynamic task where she's going to have to be reaching out forward and to the side potentially. So Betty, what you're going to want to do is reach forward with the dry washcloth to help extend or flex that shoulder. Okay. The therapist can provide, again, that initial hand-over-hand assistance to her right to help demonstrate the motion for Betty. And Betty, let me know if you're experiencing any pain.
That hurts.
That hurts? Okay, so we know that that's about as far as she can go, a little bit before that. And so can you go ahead and make that motion until you...
By myself.
Yep, by yourself. See how she's flexing her shoulder with this activity to increase that range of motion. And then you can bring it back. Let me know if you become tired or need a break to sit. Notice how I'm positioned kind of behind and to the right of Betty, so I can catch her if she experiences any kind of loss of balance, and I can help facilitate that activity if necessary. Betty, do you want to try to go out to the side with this one?
Sure.
Yep. Stand experiencing a little bit of pain?
Yes.
Okay, then you can come back. So you can see at a waist-high counter space that it doesn't really move the shoulder a bunch, but enough so that she slowly starts to, again, per the doctor, you want a gradual increase in the range of motion. So if we were to come over to, we can go over here. So to adapt the activity, again, you can have different levels of counter spaces. You can also use a wet washcloth that'll be a little bit heavier when Betty can actually perform strengthening exercises. So Betty, why don't you come over here? And again, you'll really want to be conscious of, or have Betty be conscious of her balance during all these activities, because now that she's going to have to bend over a little bit to reach, it's going to transition her center of gravity. So Betty, can you go ahead and reach over? There you go. Bend at the knees a little bit. Just until, yep, there you go. Go ahead, do a few of them.
Are you holding me? I don't want to fall.
Yep. If you start to get tired, let me know and we can take a break.
That's good.
That's good right there?
Yep.
Okay.
It hurts.
So let's go ahead and we walk over here and you can take a little break in the session. So as you saw, I was behind and to the right of Betty the entire time, being conscious so that she's not going to experience a fall. And again, when you're doing different levels of surfaces, it's going to work her dynamic standing balance quite a bit because she's reaching forward, bending over, really moving her center of gravity around. So that's going to help her prevent any falls of experiencing a risk later on. That's it. So Betty had a nice long break, and she thought that was probably a little too easy. So
How long did she have to sit there?
she had to sit there for about, what was it, 10 minutes about?
10 minutes.
10 minutes.
Okay.
Are you experiencing any pain in your shoulder right now, or is your shoulder still good?
No, right now it's calmed down.
It's calmed down a little bit. Okay. All right, Betty. So you mentioned earlier that you really like to look out that window over there. So we're going to go ahead and watch that window, okay?
Oh, good.
Okay. So can you go ahead and stand? And we go ahead and walk over there. Are you feeling all right? Not too wobbly?
A little wobbly. I'm glad you're there.
Well, let me know if you need a break or anything, okay?
Okay.
So let's go ahead and position yourself right in front of this window. And I brought the washcloth for you. So can you go ahead and grab that? And you can go ahead and start by putting your hand down here. Okay. You all right?
Yeah.
Okay. And now go ahead and slowly raise that washcloth up the window.
All the way?
Just until it starts to get a little uncomfortable, then stop.
Oh,
That's good
starting
right
to
there?
hurt, yeah.
Okay, all right. Well, bring it back down. Good. Can you try to go back up again? Up to the same point.
Yeah, this is starting to hurt.
Okay, then come back down. Okay, because it's starting to hurt, we're going to call it good for the day for washing these windows. And so for everybody else, you can see how with the higher surfaces, it's going to really facilitate that increased range of motion needed to engage in the activity. So just another way to adapt the task. You can also, we used a dry washcloth in this session, but you can use, again, a wet washcloth, which will increase a little bit of weight to the activity to make it a little bit more difficult for Betty.
So our next intervention is going to be dressing with Betty, and we're eventually going to work up to actually donning and doffing a shirt. But first we're going to do some preparatory activities. Starting in supine, we're going to do some passive range of motion. So we're going to start with Betty, obviously in supine here, and we're going to do some flexion first. So I'm going to grab her here and hold her her shoulder. All right, Betty, I'm gonna start lifting your arm towards the ceiling. You don't have to do anything.
Okay.
Remember, we don't wanna work through any pain. So
Okay.
when you start feeling pain, let me know, and that's where we need to stop. Okay? So here we go. I wanna make sure I'm looking at Betty,
A little further.
asking how she's doing.
That's good.
Okay, you feel the pain there?
It's a little uncomfortable.
Yeah, okay. And then we're gonna bring it back down, nice and slowly. All right, let's do that one again. You ready?
Yeah.
So we're gonna stretch up. Let me know.
There.
Okay. You wanna be sure to be watching Betty's face for any grimaces, as we talked about this morning. All right, so we'll do one more, all the way up. Right there. Okay, good. Okay, the next one we're gonna do is a abduction, and so we're gonna come out this way. I'm gonna hold Betty's shoulder here. And ready, Betty? I'm gonna pull your arm out like a snow angel. Let me know again. Yeah, they're pretty great. All right.
Right there.
You feel it there? Good, okay. And then we're gonna come back in. And here we go again. How are you doing, Betty?
I'm doing all right.
Okay, good.
You got me thinking of the snow.
Yeah, do you like the snow, Betty?
No.
No, yeah. It's pretty to look at.
Not when it gets all dirty.
Now, no, well, you gotta avoid dogs. Okay,
There.
yep, good, okay. So that's gonna be all of our passive range of motion today. So Betty, I'm gonna have you sit up. Come around to the other side of the mat. And, yep, okay. So you're gonna roll towards me.
Nervous of this shoulder.
Okay, yep, I'm just gonna grab or hold right here and keep this nice and safe. And then I'm gonna have you put your arms on the, or legs on the floor. Nice and slow, all the way up.
Oh, a little dizzy. Let me sit here for a second.
Yep, all right, you sit right there.
How are you doing today?
I'm doing good. Thank you
It's
for
such a
asking.
beautiful day out right now.
It is, yeah. We're gonna get you out of here soon. Go enjoy it. Good. How are you feeling?
I'm good.
Good, okay. So we're talking a lot about moving to your pain, and we don't want to move past the pain. So while we're doing some of these things, think about what you have at home, what activities you do at home where maybe you might be moving into pain.
I might not be able to reach that plant I've been trying to water. That one it's way up high.
Oh,
I can't
yeah.
reach it yet.
Yep. So that's something we're probably going to want to let Bob take care of until you.
He hates those plants.
Yeah, we're going to get there though.
I'm trying to pick ones he likes, but he doesn't like them.
Good, okay. So are you feeling okay? Okay, good. So the next thing we're gonna do, we have your shirt that we're gonna be putting on in a minute, and I'm gonna have you grab it with your right arm, which is in your hand,
Okay.
and you're gonna move your hand as far as you can behind you. Don't move past pain, so how are you
That's
feeling?
That's okay right there.
You're doing good there? Alright, I'm gonna pull the shirt up, and you're gonna take this hand, and grab the shirt.
Okay.
Good, and just gonna slightly pull with this left hand so you can feel a little stretch.
That's good.
Feel a stretch? Okay, so let's hold it there for a couple of seconds. Doesn't hurt though, does it?
No, it's okay.
Yeah?
Feel a stretch.
Yeah, stretch. Good. Thank you. Okay, good. So you can go ahead and let that go. Just let the shirt go.
Okay.
And then pull your arm from you. So we might do this a few more times, but we're gonna keep things moving here.
I'm so embarrassed that Bob brought that shirt and I hate that shirt.
This shirt? Oh, I think it's great. Schweppes?
Yeah.
Yeah. Okay. All right, so you can go ahead and sit in this chair. Give you a little back support while we're doing this. And we're gonna get your shirt on. So I know Bob's been helping you a lot with this, but we want you to be able to do it yourself, right? What we were talking about. So what you're gonna do with putting on the shirt is you're gonna be using your left hand, this hand, as much as you can.
Okay.
And so the first thing you wanna do is get a good grab on the shirt. And you're gonna take your left hand and put your right arm through it. And you wanna use your arm as much as you can, but not where you're feeling any pain.
Okay.
How's that?
Good.
Good. And then, yep, get your left arm through. Using it, good, that's great. Very nice, and then you can use your left arm to pull it over your head, because we're not quite there yet with the right arm.
So, that arm in first, and then the other one.
Yes. Mm-hmm.
Oh, better than the way I've been doing it. Oh.
Yeah, well, good. I'm glad to hear that. And you got the right idea, just pull it down.
And then Bob helps me, and he yanks on my arm. Oh,
Yeah, we don't want that, definitely not.
screaming like the Dickens.
Great, well, not great. Okay, good, so you got it on, how does your arm feel?
It's good.
Good, okay, you think you can do this at home?
That's much better, yeah.
Yep,
I can do that.
great, alright, so we're gonna go ahead and take it off. So you can use your left arm to pull it up as high in your stomach as possible.
Should I just go with it?
Yep, that can be easiest, if that's how you wanna go for it, good.
That's pretty good.
Alright, and then you're gonna pull it down just like you were. As
Good,
much as
good
you
arm
can.
first when I take it off?
Yes.
Okay.
Good. And use your arm yep,
Oh, that's not bad.
yep. Alright, so we made it a little difficult for you, we used the pullover shirt. When you're using a button-up shirt, it'll be a little bit simpler, you just
It's
put the
still
one
this
on through.
bad arm first?
That arm first, yep, and then
Okay.
you can pull it around with your left, and then put it through.
It's been 6 weeks in that dang sling. I hate it.
Yeah, yep,
This is much better.
feels good to get out, right?
Um,
Yep, so we've got probably, are you feeling a little tight, sore
it's
up
pretty
there?
sore right now. I don't know. Can I be doing something for that?
Yeah, great. So we're gonna put an ice pack on there. So we have these ice packs here, but you know, you can use a bag of peas when you're at home,
Bag of
or
peas?
you know, have Bob fill up a little Ziploc bag with some ice.
Oh, you got some pen on your pants. What happened there?
Yeah, I know. Well, I take notes all day. Just get pen on my pants. Thanks
So-
for pointing that out.
Should I put this right over here then?
Yep, just right on your shoulder, and we're gonna leave it on there for 10 minutes. And we want to make sure that you're not putting the ice right on your skin, right?
Okay.
We got a couple of layers there, so if you need a towel
Okay.
or whatever else.
Should I be taking any medicine or?
If the
I've been taking vitamins and stuff, and I guess I just don't know what else to take for all my pain.
right, yes, vitamins are good. You should be following whatever it is that your doctor has asked.
Okay.
Okay, so I can't help you with the medication piece. Follow what your doctor
Something to
says,
ask my doctor.
and if you have questions, ask him. But this ice will definitely help with that.
Bless you, John. Oh my gosh, this is so much better.
Yeah, good, good. All right, so that's a wrap.
Hey Betty, how's it going?
Oh, it's all right.
Oh, okay. So how's your shoulder doing?
Oh, it's all right. Gosh, the last therapist, she did so good with teaching me new dressing techniques. Oh, I just love her.
Good, good.
Yeah.
Okay, so today we're gonna work on your grooming and hygiene routine. I heard
Yeah.
that Bob's been helping you with that.
Yeah, I've been trying to get up on my own, trying to get my arm way up there, but it starts to get painful. And
Okay.
I don't know. I just try so hard, and I can't do it.
Okay. Well, I'm gonna do some stretches with you, and I'm gonna put some heat on your shoulder
Okay.
to kind of help increase that. Okay.
Okay.
Alrighty. So the heat pad is within. Nice, some layers. Okay. Just gonna kind of let that relax for a little bit. How's that feeling?
Well, it's feeling all right. How are you doing today?
I'm pretty good. I'm pretty good. Thank you for asking.
Good.
Alrighty. So the first stretch, I'm gonna bring your arm out as far as I can, like you're making a snow angel.
Oh, those snow angels looking okay.
Alrighty. So here it goes. Let me know if whenever you start feeling some pain, and I'll decrease that. Okay? I don't want you to
Okay.
hurt.
Okay. I'm starting to get a little pain right there, but I think you can go farther.
Okay. We'll just hold it here.
You sure? I can probably go farther.
Yeah. We'll just kind of hold it here.
Okay. I love this heat. Oh, it feels so good. I
Makes
need
you
one
want-
of these for my whole body.
Yeah, we definitely don't want to keep that on longer than 20 minutes, though. So.
20 minutes.
Mm-hmm. So we're ready. You ready for another stretch?
Oh, bring it on.
All right. Once again, let me know when you start feeling discomfort or anything.
Right there, that's fine.
Okay.
You remind me of one of my grandchildren, Steve. Oh,
Are they as good looking as I am?
you're a pretty good looking guy.
Oh,
he
thank you.
I don't like his new girlfriend though. She's something.
Wow. Have
He's a big football player down in Texas.
What does he play?
A linebacker.
Ah.
Oh my gosh, the hits.
Hmm. You ever go down to watch him?
I've been down there once, twice. I hate the heat.
I see. Yeah. I can see how it's can be a little too much.
And I worry about him though. He plays all this football and the hits to the head. Scares me.
Well, now I'm going to stretch you and have you bring your arm up, like as if you were going to reach. Okay.
Okay.
And once again, let me know if there's any discomfort. All right.
Okay. Right there's, I'm getting a little pain. You can go farther if you want.
Oh, we're just going to hold it here. So, how long did you visit Texas for?
I went down there in 1999. But he was just a young pup then. But I went back there 2008 and visited him for a little bit.
I see.
What's the name of that basketball team they have down there?
The Spurs?
Yeah, they're really good.
Mm-hmm. Absolutely.
I used to play basketball back when I was in college.
What'd you play?
Can you believe it?
I can.
Oh,
I can believe it. What'd you play?
I was a shooting guard.
I see. So like Dwayne Wade, huh?
Who's that?
He's the Chicago Bulls shooting guard now.
Oh, okay.
Mm-hmm. Those Chicago teams, apparently they're good at sports now.
Oh, I don't believe it.
So I'm going to bring you up on another stretch. Let me know once again whenever you start feeling some discomfort.
You can keep going. That's good.
So what does your routine look like in the morning?
Well, I'm tired now. I'd like to try to stay involved with the kids still, but I wake up around 7 or 8 and have some coffee and like to take a shower in the morning and do my hair. Gosh, don't I just have the most lovely hair?
I think, yeah, it's fabulous.
Yeah.
I'm going to go ahead and let you rest there with that heat pack for a little bit longer. Okay. How's your pain now?
Pain's alright.
From 0 to 10?
0.
0.
Oh yeah, it's feeling wonderful. I can do whatever I think.
Oh, good. So I'm going to go ahead and have you sit up and I'll help you. And we're going to go ahead and work on your
Should I
morning
come up
routine.
like this? Should I come like this?
No, I think you, I'm going to come around to the other side. and I'll help you out, okay?
Okay.
All right, so just kind of hold on there for me. Deepak is gone. So can you roll this way for me? Yep. Yep, just like that.
Ooh, hold me for a second. I'm busy. Big strong guy like you. Oh. Made me feel young again.
You're very young, I think, still, Betty. You got a lot of energy and a lot of feistiness, it seems
You
like.
see, I have a lot of kick to be stuff.
Yeah, absolutely. Absolutely. Someone bring the bed down so your feet are touching. Okay. So how are you doing sitting up right now?
It's coming back to me. I'm good.
Okay. So I'm gonna grab your cane and the gate belt, and then
Okay.
we're gonna walk over to the countertop over there by the sink, okay?
Okay.
All right.
Maybe pause, now pause.
Here is, I'm gonna put your cane here. I'm gonna put this gate belt around you so you're safe. Okay, go ahead and have you lift. Good.
Don't make it too tight.
Okay. We went a little tight though, so just so I have something to hold on to. Once you stand though, it loosens up. So it may feel tight now. So can I have you stand up?
Can I have my
And,
cane?
yeah.
Okay.
How are you feeling?
Oh, I'm feeling good.
Okay. Can you walk over to the sink for me?
Oh, I've seen better days.
So Betty, can you go ahead and, can you go ahead and reach over to your toothbrush? Remember to go ahead and scan from side to side so you can see
Mhm.
all the objects that you need.
Okay.
Okay. Are you in any pain right now?
Huh?
Are you in any pain?
No,
Okay, we don't want any pain.
no, this is alright.
Can you rinse? Have put a cup out for you.
Oh, right there.
Mm-hmm. Good.
Gosh, I need to take you home with me and work on some of this stuff.
Well,
I need one of you at home.
maybe we can also teach Bob to help you out.
Okay.
Yeah. So, can you brush your hair next? Is there any? Do you have any pain right now?
No, it's okay.
From 0 to 10, where would you put it?
Maybe just a 1 or 2.
1 or 2. Does it feel uncomfortable having your arm brought up like that?
No, it feels great. I just feel so good to brush my hair again.
Well, it looks beautiful, Betty. Looks
You
good.
really think so?
Absolutely.
Okay.
Good. And lastly, can you put on some of the eyeliner?
Oh, okay.
Yeah.
Fantastic.
They're all dolled up.
So some evidence and rationale to support our treatments. Obviously for the first one, we worked on active range of motion movements through cleaning, home maintenance tasks. This intervention is supported by a study by Cobell et al., who researched functional outcomes following rehab of a minimally displaced proximal humeral fracture. The study found that 77% of patients reported good or excellent outcomes, and 90% reported no or mild pain in the shoulder with a rehab program that utilized active range of motion exercises immediately following immobilization. So Betty just got out of the sling, and we went right into those active range of motion exercises. Furthermore, performing home maintenance activities while standing will improve Betty's dynamic standing balance. A study by Howe et al. Found that older adults who performed functional exercise interventions improved upon measures of balance in comparison to those who performed just usual activity.
Okay, so for our second intervention, we were doing dressing, and a case study by Withrow and colleagues found success in beginning with passive range of motion in supine and then progressing to active range of motion in a seated position prior to functional tasks, which is what we did with Betty prior to donning and doffing her shirt. We taught her a one-handed technique, as Bob had been doing that for her, using a very common one-handed technique. And then we were providing education on icing after activity based on a study by Algafly and George, who provided ice afterwards in order to decrease nerve conduction and increase pain threshold and alleviate pain.
And lastly, for the third intervention, we did some passive range of motion with that heat pack, and a systematic review by Nakano, Yambayashi, Scott, and Reed found that using a heat pack with stretching is the most beneficial way of increasing that range of motion in comparison to just using some of the other modalities that they found or looked at, such as diathermy or ultrasound. And they recommended that using it at least 1 to 2 times a day for up to 3 weeks will create the most benefit from that. And also a study by Reddick found that decreased shoulder range of motion impacts the shoulder function, which can ultimately affect the occupations or the completion of tasks. And so that's why we wanted to increase that range of motion using her grooming routine in order to have her fulfill her taking care of her plants and some of those types of things as well.
So some questions to think about after all of this. What other occupations do you think are, might affect Betty with her limited range of motion, strength, and things of that nature? So these might be other IADLs. We talked a little bit how she has difficulty watering her flowers that she wanted to water. So some things to think about. Another question, in what ways do you think her low vision affects her performance of ADLs and IADLs? Jeff did a good job of telling me to scan with his intervention to locate objects as a strategy. And finally, how would you adjust these interventions once the doctor says that Betty can push past her endpoint range of motion and have a little bit of pain? And we provided you guys all with handouts that go through the different phases of rehabilitation. So some things to think about within each of those phases. Thank you.